In this week's episode, I'd like to address post-traumatic stress disorder, why veterans struggle with getting treatment for it. As I mentioned before, the data suggests that a more holistic, multimodal approach is much better than any one kind of unilateral therapy alone. What we hear a lot of veterans say is clinically is that therapy might not work. The pills are you're just throwing pills at me. Just smoke stuff. Medications are only numbing. And again, this is why we need to take a holistic approach to the veteran and meet you guys where you're at, and with treatments, explain all the treatments and ways that you can access them and see how they could be most beneficial to you. Some of the studies I'm going to break down, again, I'll place them at the description below here, are going to look at aggression, alcohol misuse, cannabis misuse, and even some of the benefits of things like service dogs. But post-traumatic stress disorder is a lot more than just something like flashbacks or bad memories. It includes emotional dysregulation, irritability, sleep problems, substance misuse, and kind of the hyperarousal. One important thing I would add is that these kind of hyperarousal states and constant psychological and physiological tension are also associated with a lot of aggression and anger. And what I hear a lot of veterans say is, and they might not say, hey, I need to be treated for my PTSD, is they start to tell me, I can't turn it off, I can't sleep, I'm angry all the time. Sometimes they might say they don't feel like themselves, they can't even recognize themselves as their symptoms become worse. And a lot of folks are skeptical after the experiences they've had in the past about getting therapy at all. And it's certainly understandable. Not everyone in your care team is going to be a veteran. They might not be, or they are a veteran, they might not be a combat veteran. And some of those treatment relationships aren't going to work. You also just might not click with your particular care team, and it's okay to ask for someone else to kind of to see you if there's not a good connection there. But there is a lot of evidence-based trauma therapies that do work, like CBT, antidepressants like SSRIs, SNRIs, service animals, and other talk therapy modalities that can be very helpful. And these have been shown to be efficacious in both military and civilian populations. And we know that when we can improve the symptoms of PTSD, that you see an improvement in aggression, a decrease in alcohol misuse, and an improvement in kind of your functional, just day-to-day well-being. And again, this is because the PTSD, like we said in the first episode with TBI and PTSD, it doesn't exist in and of itself. This is a kind of a whole person involvement, and it involves your relationships, sleep, and emotional flexibility, and a number of other things. One of the strongest links is an association between PTSD and alcohol misuse, and there's a 2019 study that examines kind of hazardous drinking amongst active duty service members and those who are receiving PTSD treatment. And I think, it's even, I think the military in general has a rather unhealthy attachment with alcohol and culture of drinking. One of the problems with misusing alcohol in the setting of PTSD is that alcohol works on our GABA receptors, which are our neurotransmitters that kind of tamp down our brain's activity. So once that starts to get suppressed, the other neurotransmitter like glutamate, which is an excitatory neurotransmitter, starts to take over. And so it increases this hyperarousal and things like this. And this also kind of later on can lead to things like alcohol withdrawal symptoms and a number of other things, but that's for a separate video. In extreme cases, it also creates an issue with the pituitary adrenal axis, which leads to dysregulations of your hormones and any number of other things. So trying to control alcohol in particular can be very, very important here. But what the study shows is that treating the PTSD symptoms in folks who are also struggling with alcohol misuse improve things like fragmented sleep. As you can look, I mean, alcohol disrupts your ability to kind of get good quality sleep. It can worsen depression and irritability and kind of all these things. And many times that might not be, drinking the alcohol might not necessarily be the core problem, but again, it might be a manifestation of the other problems from the post-traumatic stress or other illness and things that you're dealing with. And using the alcohol as a means to self-medicate as opposed to the actual problem itself. Now, there's one interesting topic here that I think is probably a little controversial, but might be interesting to kind of discuss, is cannabis use in veterans. And a recent study published in 2026 examined folks with PTSD and who are using cannabis products and compared it to those who are still using versus those who are taking a period of abstinence from it. And what it showed was that folks who can maintain abstinence from cannabis products and undergo therapy for their PTSD had improvements with their anxiety and sleep and kind of emotional flexibility. And what was interesting was that, the ongoing kind of chronic use of cannabis products might provide some short-term relief, but in the long run showed kind of a worsening of symptoms or was not helpful. And in fact, continuing to use the cannabis products over a longer period of time would reinforce more avoidant behaviors and emotional suppression and dependency on the cannabis. Again, just similar to the alcohol as a means to self-medicate. And I think that distinction is important. And not everyone is going to fall into that camp, but I think it's something that's worth bringing up to think about as you discuss treatment with your healthcare team. Interestingly, one of the things that came out that was thought to be very helpful is, service dogs. In a 2020 study, they looked at folks who were diagnosed with PTSD from the DSM-5 and had service dogs. And it found a lower severity of their PTSD scores, improved anxiety, more social functioning, a number of things improved. And just kind of anecdotally, I feel like that makes sense. Having a sense of purpose, a pet to take care of, something, a dog who's unconditionally love you and look out for you is a powerful tool. And that level of stability and responsibility, I think, can be kind of grounding and help to get folks out of their rut. It was noted that this is more of a tertiary therapy, in addition to like pharmacotherapy with antidepressants and these sort of things, and psychotherapy. The inclusion of a service dog was found to be pretty helpful also, which I thought was kind of was cool to see here. And there's certainly a number of veterans organizations that work on getting folks service dogs. I think one of the things that's important is that we talk about what healing looks like. What does improvement look like? I don't think it's necessarily realistic to say that you're going to go from where you are now to where you were before your trauma. You can't remove that part of your existence and this kind of influential experience you went through. Trauma does change you, and healing doesn't imply that the trauma never happened or is going to go away. And kind of all these studies point to recovery looking like an improvement in your emotional flexibility. Maybe you're having less outbursts, you're drinking less, you're getting a little better quality sleep. You feel like you can go back out to the grocery store. And this recovery can be slow and gradual over time, and it can be hard to recognize your own progress. Sometimes you don't see the forest from the trees, and talking to having someone there like a therapist or friends and family who can kind of say like, no, we're noticing these big changes is important, even if you can't see it yourself.
So in kind of leaving today, to kind of wrap everything up, I wanted to share, that treatment is not hopeless. It's not a one-size-fits-all approach. There's not one treatment that's going to work for everybody, and that this is nuanced. And again, there's not an algorithmic approach to this for me, to you, to the next guy. You have to find out what works and examine all the other things that could be contributing to why your symptoms are the way they are and how severe they are, and look at addressing each of those issues. But recovery is possible. It's not going to happen all at once. And I want to encourage you to keep pursuing your recovery and healing, and be well.